Cultural safety in healthcare is essentially about creating an environment where patients feel respected and valued as people. In the Australian physiotherapy context, culturally safe practice refers to a practitioner's ongoing critical reflection of their knowledge, skills, attitudes, and competencies in providing healthcare to Aboriginal and Torres Strait Islander peoples. It involves having an understanding of the cultural differences and any power imbalances between yourself and the person you're interacting with, and how you might deliver treatment taking those factors into account. It's crucial to remember that whether or not cultural safety has been achieved in an interaction is determined by the patient receiving care, not the practitioner delivering it. Australia is a multicultural country. Culturally safe physiotherapy practice will benefit all patients in your care, especially patients of diverse ethnicities and backgrounds. It's vital that all healthcare practitioners in Australia practice in a culturally safe way when working with Aboriginal and Torres Strait Islander peoples. Under the physiotherapy practice standards in Australia, known as the physiotherapy practice thresholds, practitioners must be able to work effectively with people whose cultural realities are different from their own. To be able to do this, it's important to be aware of the unique history and cultural needs of Australia's First Nations peoples. That's where the Council's Cultural Safety Training Program comes in.
The Cultural Safety Training Program is designed to introduce you to Aboriginal and Torres Strait Islander history and culture, and help you explore how your attitudes and values can influence perceptions, assumptions, and behaviours in a clinical setting. Some of the key benefits of completing the Cultural Safety Training Program include understanding cultural safety and why Aboriginal and Torres Strait Islander peoples are at high risk of feeling culturally unsafe during healthcare service delivery. Recognise important facts physiotherapists must know to be able to provide culturally appropriate and safe services. Identify common misconceptions linked to Aboriginal and Torres Strait Islander peoples and the impact these misconceptions can have on good access to healthcare. And recognise racist behaviour and steps you can take to avoid this. The training program will teach you how you can apply principles of cultural safety to your practice of physiotherapy. The Cultural Safety Training Program is an important first step in your ongoing journey of providing culturally safe care, but it is just the beginning. There is no endpoint to cultural safety practice. It involves a commitment to lifelong learning, ongoing critical self-reflection, and taking active steps to manage risk in the provision of culturally safe healthcare.